Well, digestive problems, that's one of the most common reasons for a visit to the doctor's office.
To limit discomfort, some people skip on favorite foods, just check out of certain activities. This morning, what you might see as a surprising solution from Spinal Balance Health Center.
That's right. Welcome back, Dr. Drew Drummond, joined by one of his patients, Steve Solsky. Thanks for coming.
Good morning, gentlemen.
Thanks for having us. Thank you.
Doctor, this is a topic we haven't covered with you yet, but it's irritable bowel syndrome, IBS as some people know it. Describe what it is and the symptoms.
Yeah, well, it's irritable bowel syndrome is a syndrome, which means that it's a collection of symptoms. It's not a disease process. And the symptoms in irritable bowel syndrome, there's no organic problem behind it that can be tested. So all the conventional tests that a person would go through at the doctor's office will come up negative, but they still have the symptoms. They have bloating, cramping, diarrhea, constipation, and it's kind of weird having both of them, but they might go in 2-week cycles back and forth, or maybe they predominate with one or the other, but it really can affect their lives because the certain foods will trigger it more than others, and it really restricts diet, or even just affects their lifestyle because you're not going to go golfing 18 holes if you can't rely on your digestive system to do what it it's got to do what it should be doing when it should be doing it, and it'll restrict what people can do.
Well, what were some of the problems you were experiencing, Steve?
Well, some of the problems I was experiencing was exactly what Dr. Drummond mentioned, was the constant you don't know what's going to happen to you. And it really does affect your life. 1 minute you're just fine, and the next minute you have to excuse yourself and go off.
All of a sudden it just kind of comes on, that urge comes on. What other types of treatment had you tried before seeing Dr. Drummond?
Well, I had gone to a general chiropractor and tried that method. I had also gone to a general practitioner, my normal physician, and tried that method. I was diagnosed with IBS, and they basically put me on some medications and gave me a list about a mile long of foods I couldn't eat anymore.
So what was on that list, the no-nos?
Oh, basically a lot of dairy foods, pizza, anything real spicy, just about anything you'd go to at a normal restaurant.
Right, the best food out there.
Right,
What
pretty
did you
much.
have for dinner last night?
Last night I actually had pizza and wings.
So we've got dairy
So you haven't restricted
and
too much.
spicy, but that's because of the success you've seen. So what was the difference going to Dr. Drummond compared to those other treatments? What did you notice inside of you?
Well, first of all, it seemed like Dr. Drummond was actually treating the main course of the problem, not just the symptoms or not just the outer things that were happening. And now, ever since I've been going, I think I've been a patient of his now for about 6 months. And ever since I have gone, I've had maybe 2 instances over the entire 6 months versus maybe 1 or 2 a week.
Right, Dr. Drummond, let's get to the solution here, NUCA Care. What type of procedure exactly is this, and how does it help with people with IBS?
Yeah. First of all, I just want to thank Mr. Solsky for coming in and talking about this, because it's not exactly cocktail party conversation. So I do appreciate there's a lot of people out there that are the same way, and they just don't hear about what they need to do. But what we do is a treatment called NUCA, and what we found is that there's a bone at the top of the neck that will interfere with the way the body communicates with the brain, because it interferes with the brain stem. And your nervous system controls every single function of your body, the digestive system along with everything else. So when the nerves aren't functioning right, you're actually not getting the coordination of the digestive system to work properly, and that's what leads into the irritable bowel syndrome in people. So when we correct the top of the neck with a very gentle correction, like you see this woman getting on the screen, it clears the nervous system out, allows that body to communicate properly, and then start functioning as it should normally.
How do you know, let's say you do have IBS, how do you know if NUCA Care might be effective for you?
Usually it is, but I would need to talk to people in a consultation and an exam to make sure they exhibit at least the signs and the symptoms of an upper cervical problem.
Make sure that little bone is out of whack.
Yeah, and I can do that. There's postural things I can look for, but mainly I just need to look at somebody, and if I see the indicators, then I can take a picture of the neck, and I can see the misalignment and see if we can correct it. And that's really when I can tell a person if I think that I can help them.
Yeah, as we take a look at the skeletal system right here, talk about the adjustments themselves, because they're not painful.
No, they're not painful at all. There's a little bone that moves very slightly out of position up at the top of the neck, right at the base of the skull, and we're talking just millimeters, but it's enough to cause the problem, and the gentle adjustment just moves things within normal ranges of motion. There's no popping or cracking or anything like that.
Steve, were you surprised at how gentle it was?
I was surprised, the first time, because I was like, did you really do anything? But you almost notice immediately, because you see yourself actually get more upright almost immediately after the first visit.
How long was it before those symptoms of IBS started to subside a little bit?
Oh, within the first month.
So fairly quickly.
Yeah.
What do your friends and family think about Because I'm sure a couple of them knew that you were having these symptoms in the first place.
Well, most of them are pretty excited because now I can actually eat the foods when I go to family events. I don't have to steer away from the nacho cheese.
Yeah, yeah.
You can't skip the nacho cheese.
No, I think they said you can participate in life.
Exactly.
You don't have to say, no thanks, Mom, I can't eat that. Or if you're, an in-law made something for you, you don't have to hurt their feelings. And then the activities, are you able to get out and about and feel more secure?
Oh, basically, yeah. I can do everything I did before. So.
Yeah. Well, Dr. Drummond is so generous.
He's a generous guy, isn't he?
I know.
And he brought that special offer, and he brings it for viewers of the Morning Blend as well. The first 30 people who call Dr. Drummond's office are going to get a consult, an exam, and x-rays for only $50, and you can see the value right there.
Dr. Drummond, I disagree with you on that value. You can't get an x-ray anywhere for $245, much less everything else. But that's what he says. And so, I mean, no disrespect, but I feel like as a healthcare consumer, it's usually more than that. But no kidding, this is not sort of a fine print thing. It is $50 for that kind of value, x-rays included, just to see if this is right, to see if you have IBS, if NUCA Care works for you. It's the Spinal Balance Health Center there in Millard. The phone number is 452-3400. Online at spinalbalancehc.com. Keep in mind the first 30 people to call that number can take advantage of that special offer. But after that, he says, I've got to pay the mortgage. I can't do anymore. Steve, it's nice to meet you. Dr. Drummond, good to see you again.
Enjoy
Thank you.
the pizza and the hot wings from
Thank
now
you.
on, all right? Thanks for coming in.
Good stuff.
Still ahead, we have a dog walk.